Good evening. Welcome to Connecting the Community. I'm Lloyd Patterson. What's going on with the swine flu? It went from dominating the news a few weeks ago to drifting farther and farther back from the headlines. How concerned should we be? Are we still at risk in Northwest Florida? Let's find out from our experts. Dr. Susan Turner is a family physician and the Associate Director for the Escambia County Health Department. She's the past director of the Walton County Health Department. And Shannon Jacobs is the leader of the Santa Rosa County Health Department, holds a master's in public health. He's past statewide services director for the Florida Department of Public Health. Our number here, 484-1223 or 1-800-239-WSRE. Topic tonight, swine flu. Is it a threat still to Northwest Florida? Let's begin. Welcome, first of all, to both of you. Thank you for coming in this evening. Dr. Turner, still a threat in Northwest Florida?
Well, there is probably H1N1 virus, an infection associated with it, around in Northwest Florida, as in many places in the United States.
You want to call it H1N1, but and I understand that is the correct name, but everybody calls it swine flu, don't they?
Sure.
Okay. So you feel that there's still a danger out there?
There's still the chance of getting the infection, yes.
Okay. Shannon Jacobs, what's your read on that?
Sure, I think there's still a chance, and there's still a worry there because we don't know. We've seen a very mild form of this flu. It hasn't been very strong. And so we don't know, as the virus continues to pass from person to person and goes around the world, we're not sure when it comes back to our flu season how virulent it'll be or how strong it'll be. So it could be stronger later on in the fall. Let's
talk a little bit about the symptoms that you would expect from swine flu, and we have a graphic that we want to show here. Either one of you, symptoms, what should you look for? Fever, cough, etc.
Very similar. Is that all right? Very, very similar to seasonal influenza. Fever, frequently a high fever, cough, sore throat, feeling tired, fatigued. With this particular virus, there seems to be a little more nausea, vomiting, and diarrhea than there is with seasonal flu.
Okay, and this could be some other, could this just be regular flu? If you have those conditions,
yes.
If you have your mom has those conditions, should you panic and get her to the doctor tonight, or how dangerous is it?
No, the infection seems to be very similar to seasonal influenza, fairly mild. Most healthy individuals seem to have recovered well from it. If one's mother were at risk of complications from seasonal influenza, for example, had a chronic disease or a suppressed immune system over the age 65, they may want to contact their healthcare provider to see if they wanted to see mom.
Okay.
And we've seen a low level of seasonal influenza that is still here in the community, and that sometimes has caused some concern because someone has been sick and so they go see their doctor and they think they have the swine flu. Once they're tested, we find out that it's just another strain of the flu, perhaps the seasonal flu.
There are rumors of it going around Santa Rosa County, Escambia, all over Northwest Florida. You're hearing the people calling in and saying, hey, they've got swine flu there in Navarre, for instance.
It has died down a good bit, but initially there were quite a few. There was a lot of rumor control that we had. It seemed like if someone got sick right away, they just assumed that. And I had a grandmother who was telling an entire community of all of her friends that her grandchild had swine flu, and it was before we had any testing. And so the message spreads quickly, whenever the media was covering it. So it was definitely a time when we had to handle rumor control and make sure that the person was confirmed before we talked about it.
Are the tests available now and all through the state?
Yes.
Okay, and what does that consist of? Blood? What are you testing?
It's called a nasopharyngeal swab. If the individual is perhaps part of a cluster or is ill enough to need hospitalization, the Department of Health is asking doctors to get a nasopharyngeal swab. That's taken by using a longish swab that goes back in the nose to the space between the nose and the mouth.
Oh, that's way back.
It doesn't hurt, yes, but it is way back there. And that specimen then is submitted to the Florida Department of Health State Lab, and we do have one of those here in Pensacola. The health department is notified, and our lab has the capability of doing the test to determine whether it's the H1N1 swine flu.
Okay, so you've tested. How many times has this been tested, do you suppose? Have you been running through these tests every day, or is it kind of rare that you even test for it?
I'm going to estimate in Santa Rosa we've sent about 30 samples to the state lab. Now, a lot of the rapid tests are done there at the doctor's office, and they find out that it's not influenza A. So if it is influenza A, though, and we feel like that it's a suspect case, then we've sent those samples to the state lab. And I think we've had about 30 or so, and all of those but one were negative for H1N1. They were another strain of flu.
You going through a lot of these tests in Escambia County?
We did. When we were initially, as the Department of Health, testing any suspect case, we went through a lot. Our physicians, our hospitals went through a lot of the test kits, and our lab did a lot of tests. At this point, the recommendation now is just that those who need hospitalization or are part of a cluster in a living situation like a nursing home that might put those nursing home residents at risk get tested. And the Department of Health isn't recommending that others get tested at this point.
All right, if you just joined us, this is Connecting the Community here on WSRE, PBS for the Gulf Coast, and I'm Lloyd Patterson. Our guests tonight are here talking about the threat of H1N1, swine flu. If you have a question that you'd like to get answered on this topic, the number will be right on the screen. Let's take a look right now at the swine flu cases. In Florida, there are 139 cases that were reported up to yesterday, I believe. Alabama, 67 cases. Texas, 1,358 cases reported in Texas. And in the U.S., the whole country has about 8,000 swine flu cases. Now, this is no means death. These are just reported cases. The one in Santa Rosa County we know about. When I look at these numbers, I'm wondering, first of all, what the heck happened in Texas that they got all these cases?
I'm not sure I know the answer to that.
Okay. Yeah, what theory do you have on it, Shannon?
I don't know. That's another one. It's very difficult. The CDC is examining that. There are a lot of states that have had in the high 800s, 900s, even over 1,000, and there's not an explanation at this point. I mean, we look at it and we really don't understand how those states, because they're using the same testing that we have. Perhaps it's the proximity to where they are to Mexico, to where some of the disease started, but really it's all a guess at this point. I don't know that there's a lot of science out there to be able to base anything on.
How is it that we go from a sickness that affects a pig to it going into us? We're not getting it from eating pork, are we? We know, we're pretty sure of that.
Absolutely.
Okay, so how does something jump from the animal to the human?
Well, when you have animals sick and humans sick, viruses can intermix their genetic material. I'm not sure that I understand that down to the molecular level, but viruses do that. And in fact, this particular virus doesn't, though it's called swine flu, it doesn't only have swine flu characteristics, it also has avian flu characteristics, which was one of the things that most concerned the experts at the beginning, because the feeling was that the previous pandemics across the world might be related to avian influenza, and they were very concerned that this might have more virulence based on that component. As we can see at the moment, it seems to be a fairly mild illness in the United States.
All right. Shannon?
Yeah, I would agree with Dr. Turner there, and I would add, in a lot of different cultures, they're not like the U.S. in that they're more intermingled with animals. Some have animals that live in their homes, animals Absolutely. That live in their yards and those kind of things, and so sometimes it's a little different relationship than what we have in our society in the living quarters, and so sometimes that attributes to the passing of the disease as well.
Yep. Years ago, I visited down in Mexico and lived in a little place where pigs were roaming around. In fact, I think the pigs had lived in the place before they rented it to us, and they were just outside the door. So I can see where living close to, they're vastly closer to animals than we live in the U.S., except for perhaps cats, dogs, that sort of thing. Do animals are family pets in any danger from this, or are they immune to it?
I read something yesterday that was much more expert than myself that said that it didn't seem to have a component that infected domestic pets.
Mm-hmm. Okay. And once again, if you have a question, 484-1223 is the number here at WSRE. Let me ask you point blank. We've had 5 years ago, I believe it was the avian, the bird flu, and that turned out to be sort of, well, not that much. Now we've had swine flu, all the lead story on the networks and the big story in the paper, and that's really not been all that much, has it? Is there a danger to, if the public keeps getting this idea that there are the health officials going around saying, oh, watch out, this is terrible, you're in trouble now, and nothing ever happens, maybe the next time around people aren't going to listen to you guys. Does anybody ever consider that?
Absolutely. Although the avian influenza, I don't think it's fair to say has really turned out to be nothing. Actually, it remains kind of a scary character. Hanging out over in countries in the other hemisphere, there are still human deaths and very high mortality rates associated with human infection with avian influenza. It's not shown a propensity to transfer from person to person very well, and thus we've not worried about it in our country yet. But were it to change, it could certainly pose a very serious threat. The mortality rate in humans is actually quite high of that illness. So,
are you talking worldwide?
Yeah, in the other hemisphere where that's present, where that infection is present, yes.
Okay, but in Northwest Florida,
right.
The United States, this has not been much of a, but it really hasn't.
Well, you could use the example of a hurricane, though, and if a hurricane's going to hit some other area, then people in our area think, oh, it's not going to happen here, I'm okay. But I think we've learned along the Gulf Coast that we need to be ready. We need to always err on the side of caution and be prepared. And so I think when events like this happen, that sometimes it may not necessarily hit as hard as we thought it would. Sometimes, like in a hurricane, we think it's going to be a 4 and it comes in as a tropical storm. But we have to be prepared for the worst. And we'd always, in public health, rather err on the side of caution and protect lives than to not be ready and to say, oh, it's not going to happen here, and then it happens here and affects our residents.
Yeah, you feel like you really have to play it safe. Right. And when you look at the history, and I'm talking about in the United States, the history of these epidemics, you go back to, and we have a graphic on this that I want to show. I can't see the monitor in here, so I don't know if it's up or not, but it's the history flu graphic, and they had the Spanish flu in 1918, killed 500,000 people in the United States. 500,000. Then, in about 1958, I can't see what the name of the flu is, but you'll remember it, and that killed about 34,000, I believe, or 60-some thousand. And then we had another flu, the Hong Kong, come along, and it killed less and less. So does that tell you that this drop-off from killing 500,000 people 100 years ago with the Spanish flu to today, does that tell you that we're getting a whole lot better at handling this stuff? What's changed? Why don't flus like swine flu come along and do like a Category 5 hurricane on us?
Mm-hmm. I'm not sure that there's an answer for that either. The viruses are very quick to mutate. And in fact, in the 1918 influenza pandemic, the first several rounds, so to speak, in the United States were very mild and didn't seem to cause a lot of mortality. And then as it came back other seasons, it seemed to cause much more mortality. It seemed to have become much more infective and also more virulent, more serious for the human being host. So viruses just change and mutate, and the best we can do is hopefully develop influenza vaccines when we know there is a virus circulating, but also plan ahead and be ready for that Category 5 in case the virus turns out to be a Category 5 virus, if I can use that metaphor.
All right. We have a call from Judy in Pensacola. Go ahead. Do you have a question?
Yes. Hi. Hello. I have a question. You get your annual flu shot, and I was wondering, does that afford you any type of immunity to this flu?
Okay.
The swine flu?
Okay, good question. You get your annual flu shot at the doctor's office. Are you covered?
It's a really good question because we want people to get their flu shots. We do still have our flu season coming in the fall, and we want people to get their flu shots. The experts say there is not any protection in this past season's flu shot against this H1N1 swine flu.
Okay, no protection at all.
Right.
Right. It was a different strain, so that vaccine was designed to treat the strain that was the seasonal flu, and this is a different strain. So they're saying that it's not designed to protect against it.
That's the thing that's got to throw you off every time a flu comes around. You never know if you have the right medicine to give people, do you?
Absolutely. It's a guessing game, although it's quite an educated guessing game that the experts have developed answers to over time. The flu season happens in other countries at different times, and the strains of influenza seen there tend to then circulate to the United States. So that advantage is used to develop our flu vaccine from the strains that are known to be circulating earlier in other parts of the world, so that then we have a flu vaccine to protect our country.
And that's worked pretty well. That's why we're getting ahead of the game, so to speak, with these new flu strains that come along, because we get this head start on them.
Yes, one hopes.
Shannon?
Yes, we do, and also as the body sees those strains, then the body develops a certain level of immunity on its own. So once you've had that illness, then you develop a certain level of immunity, and that was the initial scare. And what we've seen with this novel strain of swine flu was that it wasn't something that we had seen before. So the body had no immunity to it. There had been no vaccine. And our bodies had not built up any type of protection against it.
Okay, we have another question. Sylvia, go ahead. You're on the air.
Yes, my husband has emphysema and he's sick a lot, and he's catches everything, and I just wonder if I should be taking him to the doctor all the time, or what I can do to protect him in some way, please.
Okay, thank you. Thank you very much. Good question.
Sure. Absolutely, there are things you can certainly do to protect him. In fact, he is probably one of those individuals that needs to get his annual flu vaccine. Influenza is a very serious illness for individuals with medical conditions like that, and the flu vaccine is a good way to protect your loved one who has something like that. In addition, really the very best thing that we can do for ourselves, all of us, and especially those of us who are at risk of complications from flu, is wash our hands. Our hands are generally the mechanism that things get spread to ourselves as we leave our home and touch countertops and doorknobs and money and all sorts of places. We then transfer the viruses to ourselves via our nose, eyes, and mouth. So it's really important for us to use what we call good hand hygiene. And then it's really important for the individual who called to encourage her friends and neighbors when they're sick to stay home, because that's our other community mechanism to protect her husband, is to make sure we encourage people who are ill to stay home and stay away from individuals who are at risk of complications from illness.
Don't go out shopping if you suspect that you might have it.
Absolutely.
That's a really tough one, though, in this economy, because a lot of people have to go to work. A lot of people and the children have to go to school. So a lot of times you don't want to get in trouble at work, so you're like, oh, I'm going to have to go in. And so we've tried to communicate to our businesses as well to say, you don't want a sick person coming in. They're going to infect your entire workforce. It's better for you to send that person home.
In New York City, I believe they closed several schools because of this, and in fact, there was a principal or one of the administrators of the school system there who died, I believe, from this. And there haven't been any closings around this area that we know of, have there?
Not in this area. That was something that we really had a lot of serious discussions about, though, whenever the outbreak first happened. And there are a lot of considerations. When you close the school, you're pretty much economically shutting down your community because the parents can't go to work. The kids are staying at home, and then you've got to think about, well, how are they going to make those days up, and those type things. So we had some very serious discussions at our Emergency Operations Center in Santa Rosa with the school district and with our emergency management officials about how we would handle that. And thankfully, it never came to that in our county.
Yeah, so not something that you do lightly by any means, I'm sure. Deborah, in Escambia County. Go ahead, you're on the air. Hello?
Hi, yeah. I'm a teacher here, and I was wondering, is this epidemic going to peak in the fall or the summer? Because if it peaks in the summer, maybe there'll be some safety with the kids being out of school. And also, I'd like to know, as a teacher with kids coming in and out of the classroom all the time, what should I do to keep the virus down in the classroom? I appreciate it, and take my answer on the air. Thank you.
Thank you. Okay, what about it? Want to think about that for a bit?
I'd love to give Deborah a suggestion about keeping infection down in her classroom.
Yeah, I could do that.
It's very important to make sure that the children use good hand hygiene, especially before they eat their meals or snacks, as the case may be.
Have you seen kids lately? How they're that's asking a lot.
Absolutely.
Yeah.
Yes, absolutely it is.
I've got an 8-year-old, so I know.
Right.
Many people have recommended that teachers, for example, keep hand sanitizer in their room and when kids come back from recess, and other times when they share each other's germs, using the hand sanitizer.
How
And of course,
effective is that stuff? Is that worth it? You don't have to go wash your hands then in the sink. You can just squirt this stuff on. It kills the germs.
Yes, absolutely. Yes. Yes, absolutely. It works just as well.
It works just fine.
Yeah, the alcohol-based, if it's rubbed fully into your hands, is typically very effective. Another thing with this virus, and for teachers, it has not shown to last for a long time on a surface. So even the schools that were closed, they did some surface cleaning, but it wasn't like it stayed in the classroom for a long amount of time. But if you have the ability to be able to clean up, especially your desk, if the children come up to your desk, I think that would be a good thing. And if a child is sick, maybe asking them to call in their parents, or having the principal call their parents and maybe asking them to go home. Especially if they're very sick and coughing and sneezing and doing those kind of things. Talk to them, ask them if they've seen their doctor, and maybe talk to them about staying home. But I think that's something that a teacher could really be highly effective in, maybe helping some of the other kids not get sick as well.
Right. In some places we saw pictures of people wearing the protective masks. Does anyone need to do that? Someone whose health is maybe a little more fragile? I don't think not a teacher probably wouldn't want to do that in the classroom, but in some places I saw that practically everybody was wearing them, in airports, that sort of thing.
It's not recommended. Actually, the most effective way to use a mask, were someone to use a mask, is if they themselves were ill. The droplets coming from their mouth and nose that could infect others would be stopped by their mask. But in fact, someone who's not ill, who's wearing a mask out in just the regular air, it probably doesn't do a very good job of filtering out droplets. It's not needed at this point.
Oh, so it's protecting more the person who's wearing it if it's sick. It's protecting other people.
Yes.
You're not protecting yourself much by wearing those masks.
Yes.
And that's typically how we've advised the doctor's offices, if they have someone who comes in who's very sick, is to give that person a mask, and that their staff doesn't necessarily need to wear one. They're, of course, very uncomfortable, very hot, and very difficult to work in and to communicate with. So it's difficult for to use those. I think you saw a lot of that, and you saw a lot of pictures of that initially whenever the virus first happened. And I think that the media really zoned in on that, and you saw it around the country. But here, that recommendation never really was something that we did for our healthcare workers or for school workers.
You don't feel that the health officials around this area or around the country overreacted to it? Did they respond appropriately?
My personal opinion is they responded as they had to. I really like the metaphor that Mr. Jacobs used of the hurricane. As the virus showed itself in the United States, it seemed to have a history in Mexico of being quite a severe viral illness, causing quite a lot of mortality, which is what is projected to happen at some point during a worldwide pandemic. So I feel that they really did have to react very strongly at the beginning, and we reacted very strongly. We geared our staffs up to work with the doctor's offices and the hospitals to find any cases that might be this influenza, and tested many, many, many people looking for the virus to be present so that we could contain it were it here.
What eventually happens to these viruses? Do they just sort of float away into the ether, or do they mutate into something else? We don't worry about Spanish flu anymore, the Hong Kong flu. What happens? They run their course and they fizzle out and something new comes along?
Well, they need a host. They need things to infect in order to be spread from thing to thing. And so that's one reason you see, worldwide spread for not completely understood reasons. Flu virus spreads between people during particular seasons in different countries. And then the virus mutates. It just mutates rapidly and changes.
Okay, we have some information. If you'd like some more information about what we've talked about tonight, floridashealth.com is one website. And then there's a state swine flu hotline, sort of, at 800-775-8039. And something we've started here recently on WSRE at our website, wsre.org/CTC. There'll be links to the things we've been talking about tonight, symptoms, etc. And then next week, the program itself should be online if you'd like to catch up, see something you missed. What is just good common sense stuff as we go out of here tonight. Be careful, wash your hands a whole lot. What else can people do? Decide to stay home and not go out anymore.
I think you're hitting them, the big three. It's usually easy to remember things in threes. The big three are to stay home when you're sick, to wash your hands, and then to cover your nose and mouth when you sneeze or cough. And if you do that, we ask people to not cough into their hands or sneeze into their hands. We're teaching people to either have a tissue or either to sneeze into their upper sleeve, because in our society we shake hands a lot, we touch things a lot. So if you do those main three things, you're going to be able to protect yourself not only from the H1N1 flu, but also from the seasonal flu and from other disease. Okay.
Doctor, anything else that you'd recommend?
I guess I really could just echo that. It's really, really important, very hard for people to stay home because of peer pressure and the need to bring home a wage, but it's really, really important for people to stay home when they're sick. Make sure they don't cough or they can spread it, and wash your hands when you're out and about.
And they can call your office and get medical excuses then, right? Because they need to stay home. Thank you very much, Dr. Turner, Escambia Health Department, and Shannon Jacobs with the Santa Rosa Health Department. Very informative.
Thank you.
Appreciate you being with us here tonight. I'm Lloyd Patterson for WSRE, PBS for the Gulf Coast. Thank you for watching. Good evening.